Hello there, and welcome to your Infertility webinar. I'm Jessica Boone, and I will be guiding you as to why you should be switching your mindset around infertility from thinking of it just as a condition, but to more of a symptom. As I said, I'm Jessica Boone, and I'm an infertility PA turned fertility consultant, and I help couples transform fertility struggles into empowered success stories by embracing a whole person approach and making sure that you are heard every step of the way. This is the foundation of my company, Fortitude Fertility Consulting. Whether you're just starting your fertility journey or have already experienced setbacks, this webinar will provide you with a basic foundation of understanding your fertility, go over the common factors and underlying issues that could be impacting your fertility, and then resources for how you can boost your fertility and knowing what is in your control versus what is out of your control. And most importantly, I'm here to help you switch your mindset so that you can embrace a healthier future for you and your growing family. So just some basic housekeeping things before we dive in. All information in today's webinar is for educational purposes only and is not a substitute for seeking and following medical advice. In the next 40 minutes, I'm going to show you how to really navigate and make sense of this overwhelming amount of conflicting information available online. We're going to debunk some of those common myths and misconceptions. We'll discuss strategies to ensure your concerns are heard and respected in the complex world of infertility. We'll review knowledge about your fertility and common causes and underlying factors that could be causing your infertility. And we'll discuss the importance of looking beyond the basics of fertility factors like sperm, eggs, and uterus, and really get to the root cause of your infertility. And then we'll also learn some resources to help you make some informed decisions about your fertility treatment and care. But best of all, by building a strong foundation of understanding and addressing the root causes of your fertility challenges, and then learning about what is in your control to optimize them, you can confidently say that you have taken every possible step to make your dreams of parenthood a reality. This whole person approach not only maximizes your chance of conceiving, but also lays the groundwork for a healthier future. Before we dive into all of this amazing information, I want to share a little bit more about me. I'm Jessica Boone, and I am the CEO of Fortitude Fertility Consulting. Through my concierge fertility consulting practice, I help couples transform fertility struggles to empowered success stories through tailored fertility plans to help them regain hope and healing. And I have been practicing as an infertility PA for over a decade, and I'm extremely passionate about destigmatizing infertility and educating people like yourself so that they can feel empowered and knowledgeable about all aspects of their fertility and treatments. Having worked on both the male and the female sides of infertility, I have a really unique perspective to view this whole fertility picture. So many people ask why I made the switch to fertility consulting, and I think it's really important to take a step back and learn more about how I received my training and my experience with that. So when I stumbled out of PA school, I was really lucky to find the field of infertility, which is where I've been my entire career. I was also incredibly lucky to have found an amazing collaborating physician who prioritized the patient experience and emotional well-being above anything else. I like to joke that I got to practice the way medicine is supposed to be practiced, without insurance or appointment times really dictating our care, and I absolutely loved it. But then a few years into practicing, I had this huge epiphany. Most people have heard the statistic that 1 in 6 couples have difficulty conceiving, and I remember when that 1 in 6 became my reality. It was about 9 years ago now, and I had only been practicing for a few years as an infertility PA, and I got a call from my best friend who just said that they had found out that they received a medical diagnosis, and the only way that they were able to conceive was going to be through IVF. And despite having a career focused on helping people become parents, this really rocked me. I was not prepared to how to emotionally kind of help support this couple through their fertility journey. And my friend, she is super well educated. She took every precaution to optimize her health and chances of pregnancy, and this was 100% out of her control. She felt lost and alone and just didn't know where to turn to for support. And that's when this moment hit me. That's when things really came into perspective and where I made my switch from really approaching this as a medical professional. Instead, I now kind of support patients on their fertility journey with a little bit more of kind of that emotional coaching piece going on instead of kind of the more traditional fertility care model. So I like to say it was the moment that I became my patient's ally on their fertility journey instead of just their healthcare provider. And it was the moment I realized that I really wanted to support people differently on their path to parenthood. So after that, I spent years guiding patients, friends, colleagues, you name it. I was talking to everybody about fertility. And what I've learned is that one, there's no path to parenthood that is the same. What works for one person may not work for you, and it is important that we take a personalized approach to your fertility journey. When you are struggling to conceive, many people feel lost or alone on their journey, and this is number two. You are often unsure of where to turn to for reliable answers or emotional support, and this should not be the case. No matter where you are on your journey, you deserve to feel supported, empowered, and educated about the process. So imagine you're on your path to starting or growing your family, but you're feeling really lost, overwhelmed, and just uncertain about the future. Does this sound like you? I see some of you, shaking your heads. You're not alone. Your journey to parenthood might look different than expected, but with the right support, knowledge, and understanding, you can navigate this path with confidence and empowerment. And this best part is you're in the right spot. You took the time to show up today, and by being here, you're going to learn how to take control of your fertility journey. And this is huge. So I always like to spend a little time going over some common misconceptions about infertility. Every Friday on Instagram, I do something called Fact or Fiction Friday, where we provide clarity to some of the most commonly misunderstood topics in infertility. So whenever I'm doing a lecture, I like to start my lecture this way. So let's get started. We're going to start off with a big one. Infertility is primarily a woman's issue. What do you guys think? This is absolutely fiction, but you would be so surprised by how many people still believe this to be fact. This is probably the biggest myth in infertility and the reason why we're having such a big conference or summit about women's health. The truth is infertility affects men and women almost equally. And recognizing that infertility is a shared concern is crucial for couples. And it's really important as providers that we encourage both partners to seek evaluation and support at the same time in their journey. This should be a unified approach. However, there's still a lot of stigma surrounding infertility. For many couples, this is the typical trying to conceive timeline. Even though male factors contribute equally to infertility, the expectation typically falls on the female partner to kind of get this whole thing started. So she's tracking her menstrual cycle, she initiates the fertility workup, and by the time the male partner is even evaluated, the couple has been trying for well over a year. There was actually a study that came out recently that showed on average, men are not getting evaluated with a semen analysis for almost 22 months into the trying to conceive journey, which is just wild. And so recognizing that infertility is a shared concern is really important. And as providers, we need to be doing better to be sure that, couples are getting evaluated, getting a comprehensive evaluation and taking a unified approach to this evaluation. So here's our next one. You will get pregnant if you just relax and stop thinking about it. I'm sure many of you have been told this. So what do you guys think? This is most definitely fiction and probably the most useless and frustrating piece of advice that someone who is struggling with infertility can be given. It turns out there's a lot more to getting pregnant than just having sex. There are a lot of other things that are out of your control, but there are many things that are also within your control. And so it involves knowing your body, understanding the science behind it, and a little bit of luck. In fact, infertility is more common than you think. Approximately 1 in 6 couples in the United States have trouble conceiving. This increases over the age of 35. If we look at this pie chart here, you can see that 30% of the time, the cause of infertility is strictly a male factor. 30% of the time, it is strictly a female factor, and about 10% of the time, it's a combined male and female factor. And so when we're looking at the math, men and women contribute equally. So the big takeaway here is, don't forget to include the male partner in this conversation. Regardless of what factor is contributing to your infertility, I feel that if you take a unified approach to your trying to conceive journey, you can achieve the goal of growing your family much faster. And this, it's important to realize that this is not a female issue, it's not a male issue, but it's a couple's issue and something that should be approached together or unified. So let's kind of get into the meat and potatoes of our lecture today. When it comes to fertility, I like to think of fertility as a window to what's going on with your overall health. Let's talk about infertility in a way that's a bit different from what you might be used to. Usually, when we hear someone say that they're having difficulties getting pregnant, we just kind of call it infertility and leave it at that. Some might even think it's just bad luck or something that they did wrong. But here's the thing, it's so much more than just a label or a diagnosis. It's important that we think of infertility as your body trying to tell you something, kind of like when your car's check engine light comes on. Having fertility struggles is a clue that there might be other health-related things going on beneath the surface that really might need your attention. So why do we think of it this way? Why should we kind of approach this infertility mindset a little bit differently? Well, when we look at it this way, it changes the game. Instead of feeling, stuck or blaming yourself, you can see it as an opportunity to really dig deeper into your health, to figure out what's really going on. And this approach not only improves our chances of conception, but also supports our long-term health and wellness. And this makes sense because our bodies are really smart. It will really prioritize things like brain function, heart function, lung function, because those are things that are essential for living before it's going to spend time making sperm, eggs, and worry about ovulating. So when we face fertility challenges, it's often a sign that there's likely something else going on with your overall health that is negatively impacting your fertility downstream. And the endocrine and immune systems are all really connected, as well as your digestive system. Everything is connected and everything can impact your reproductive health. Imbalances in one system can lead to disruptions in another and therefore affecting your fertility. By understanding the body's natural priority system, we can better appreciate why fertility might be impacted when our health isn't optimal. This insight is crucial for anyone who's on the fertility journey. So this is important if you are a man, a woman, if you are trying to conceive on your own, or if you're considering fertility treatments. Understanding these underlying issues is huge and can be a game changer in getting you answers on your fertility journey. So what are factors that can impact your fertility? In the traditional fertility care setting, there are 5 main factors that can impact your fertility for both partners. You have age-related fertility decline, hormone disturbances, abnormal anatomy, genetic factors, and chronic medical conditions. So let's first review age-related fertility decline. This is by far the number one cause of female infertility. And we see this is often labeled as diminished ovarian reserve, if we're going to get really technical here. So this is because a woman is born with all the eggs that she will ever have, unlike men who continue to produce sperm their entire lives. A woman is born with about 1 million or so eggs, and by the time they hit puberty, they only have about 300,000 or so eggs left. Of the eggs that remain, only about 300 to 400 will be ovulated over her entire reproductive years, and then the rest will simply just be lost to Mother Nature. Fertility in women typically peaks between the ages of 20 and 24 and then will steadily decrease over time. And we see the most dramatic decrease starting around age 32. And then after age 36, we see big changes in egg quality, egg quantity, and an increased risk of having a chromosomally abnormal or genetically abnormal embryo, which can increase that risk of miscarriage. And you can see that illustrated here in this graph. What surprises most people is that both men and women will experience a decrease in fertility as they age. Yes, you heard that right. Male fertility is impacted by age. And so it may not be the same or as drastic, but you can see here in this graph that male fertility does change over time. Most of the research suggests that this can start to transition sometime between the age of 40 and 45. And we usually start to see the biggest changes come by impacting the motility. So let's review how hormonal disturbances can impact both male and female infertility. In females, when we have a hormonal disturbance, it typically causes problems with ovulation, meaning that the ovaries are not releasing an egg consistently or at all. And this is very common. We see this in about 25% of cases where female infertility is a factor. The system that controls ovulation and our menstrual cycle is called the hypothalamic pituitary axis. It's essentially how our brain communicates with our ovaries and uterus through hormones. And I'm going to get a little sciencey on you for a second, but I feel really strongly that every woman should understand how their body works. So let's dive into this. Early in the cycle, when the estrogen levels are low, the brain signals to the pituitary to release a hormone called GnRH, or gonadotropin releasing hormone. This causes the anterior pituitary to release FSH and allow the growth of the follicle on the ovary. The growing follicle then releases estrogen. This triggers the shutoff of production of FSH and is your body's way of kind of protecting you from releasing too many eggs or multiple eggs in a cycle. So early in the cycle, FSH and estradiol initially have a negative feedback relationship. So if we use a car analogy here, you can think of FSH as a measure of how hard your body needs to step on the gas in order to make a follicle grow. That's the positive feedback. Estrogen is the foot on the brake. That's the negative feedback. And at the end of the follicular phase, FSH and estrogen actually switch, and they have a positive feedback relationship. As the really high levels of estrogen, typically above a level of 200 picograms per milliliter, trigger the anterior pituitary to release more FSH and, the most important thing, LH. And remember, LH is what triggers the release of an egg and causes ovulation. If a woman is having regular menstrual cycles, she is probably ovulating. Cycle lengths between 25 to 36 days are usually considered ovulatory and regular. If a woman is having a menstrual cycle maybe every few months or only a couple times a year, she's probably not ovulating or not ovulating very frequently. And these cases, the nice thing is that these often can be successfully treated with fertility medications. Common hormone disturbances include failure to produce a mature egg or anovulation, and we see this commonly in PCOS, or polycystic ovarian syndrome. You can have a malfunction of the hypothalamus, meaning that signal from the brain to the body is not working correctly. An example of this is hypothalamic amenorrhea. And you could also have premature ovarian failure, which is pretty rare, but it's another cause of anovulation, where a woman actually, goes into menopause a little bit earlier than we would expect, usually before the age of 40. And so there is thought to be some sort of genetic predisposition for this. You can also have a malfunction of the pituitary gland, and this can be due to physical injury or a tumor called a prolactinoma that produces high amounts of a hormone called prolactin and can really throw off ovulation. Similar to women, the hypothalamic pituitary axis in men really regulates the hormonal events that allows for the testicles to produce sperm. Given that this system is incredibly complex, I feel that the best analogy to use when explaining it is to again think of this kind of like cruise control in a car. The testicles are the car engine, and all the hormones at play are helping the engine run. The LH and FSH increase the speed, which is, i.e., the production of testosterone in sperm. And estrogen is like your foot slamming on the brake to slow down that engine. That's the negative feedback. Testosterone is the gas and has all the power to both positively and negatively affect the speed of the car. If this pathway is not functioning correctly, we can see negative impacts on semen parameters and just overall fertility potential. So let's dive into some abnormalities that we see with within the male and female anatomy. There are really a number of conditions that can result in changes to the female anatomy, and that can significantly impact your fertility. So let's start with reviewing things that can impact your ovaries, which is where the eggs are stored and released. So things like prior surgeries, infections, and endometriosis can all potentially damage the ovary or cause scarring, which can thicken that outer capsule of the ovary, making it difficult for an egg to release. You can also have tubal disease that can absolutely cause issues with infertility. In fact, we see this in about 25% of cases of infertility. And the main cause of tubal disease is typically infection. Infection caused by either bacteria or viruses, usually sexually transmitted. So an example of this is pictured here. You can see the infection left some scarring here, and it actually kind of created these like white little, we call them adhesions. But then what happens is fluid can build up in the fallopian tube, causing something called a hydrosalpinx, which is what's down there in red at the bottom. And that can actually become a serious condition where the tube needs to get removed because it becomes infected. You could also have abdominal or pelvic disease, such as appendicitis or colitis, or just really any inflammation or scarring that previously was there that can change or distort the position of the ovaries or the fallopian tubes or both. Endometriosis can also just wreak havoc on the entire system. I like to think of this as like retrograde menstrual flow, and not only does it distort the anatomy, but it causes a ton of inflammation. In at least 10% of all cases of female infertility are caused by an abnormal uterus. So possible uterine abnormalities include scar tissue, endometrial polyps, adenomyosis, fibroids, an abnormally shaped uterine cavity, and all of these are pictured here. Rarely, but more commonly than you think, we see congenital abnormalities such as a septate uterus, which are pictured here. And having this septum or any uterine abnormalities can disrupt implantation and making it either increasing that chance of miscarriage or making it difficult for implantation to occur altogether. Conditions within the cervix may also impact fertility, but they're rarely the sole cause of infertility. They're pretty rare. About 3% of couples face infertility due to problems with the cervical mucus. And oftentimes IUI would really easily overcome this. The most common reason for abnormal cervical mucus is hormonal imbalances, namely usually too little estrogen or too much progesterone. And then you can also have problems due to a history of having an abnormal pap smear where you may have had an operation done on your cervix called a LEEP or a loop electrosurgical excision procedure. Sometimes women who have these can have stenosis or narrowing of the cervix, or sometimes even scar tissue can happen. And if you conceive within 12 months or so, you want to just kind of keep an eye on your cervical opening because sometimes you can have an increased risk of miscarriage due to conceiving within 1 year of having this LEEP procedure. There are also a variety of physical problems that can cause male infertility, and these problems either interfere with the process of sperm production, so disrupting the pathways where sperm travel from the testes through the rest of the reproductive tract. A varicocele is the most common, one of the more common things that we see. And this is where we get enlargement of the veins around the spermatic cord. And this is actually the most common reversible cause of male infertility. You can also have damage to the vas deferens, which is the tube that carries the sperm from the testicle through the rest of the reproductive tract. And this could be due to scarring, infection, or even having genetic abnormalities or a vasectomy where, this was intentional, but now we want to reverse it. And rarely you can have things like retrograde ejaculation, where instead of the ejaculate flowing out through the penis, it actually goes backwards into the bladder. And this accounts for about 1.5% of male infertility. And less commonly, we have genetic factors. There are definitely certain genetic conditions that may kind of predispose you to having infertility. We have kind of two major conditions. You can have a major chromosomal abnormality, which changes the number or the structure of the chromosomes which carry the DNA. And these changes often affect many genes. And so the normal number of chromosomes for a human is 46. Women have 22 pairs of autosomes and 2 X chromosomes, where men have 22 pairs of autosomes and then they have an X and a Y. We also have something called single gene defects, which involves a mutation or an abnormality within a particular gene, so a very small segment of the DNA, and that can lead to either a health condition that can cause fertility-related problems. And lastly, chronic medical conditions can also impact your fertility, and this is something that many people don't realize. So for women, this can be due to like endometriosis, fibroids, diabetes, autoimmune conditions. So many things can impact your fertility. So it's really important that we are getting your medical conditions dialed in and in a, healthy range before we start our trying to conceive journey. Otherwise, you can have an increased risk of implantation failure, miscarriage, or potentially more complications that can pop up during pregnancy or delivery. And up to 44% of men actually have who have infertility actually have a medical comorbidity that's negatively impacting their fertility. So the major players for guys are uncontrolled hypertension, which is blood pressure, uncontrolled diabetes, obesity, and testosterone is a big one. We have so many guys who are taking testosterone replacement therapy and are just unaware that that can actually cause them to have a decreased or absolutely zero sperm count. So this is huge. So what factors do we see that are underlying that could be in fact your fertility? Because in reality, we have these traditional factors that we talked about, but what's causing those? It's usually underlying factors that are the root cause of these bigger or more traditional factors. So we're talking factors like chronic inflammation, more hormonal disturbances, nutritional deficiencies, gut health, and chronic stress. So let's review those a little bit more individually. Many of the common factors that we know to cause infertility are actually fueled by chronic inflammation. So chronic inflammation is like having a small fire burning inside your body all the time. It's not the good kind of fire that, keeps you warm. It's the one that actually can slowly damage or cause inefficiencies in your body's system, including those critical for making babies. For women, one clear example of this is endometriosis. This condition, changes your anatomy, but also is one of those things that can really wreak havoc with inflammation. And so it can cause inflammation within your pelvic cavity, which causes pain. It can make it challenging for the sperm and the egg to meet. It can also cause inflammation within the uterus, making it even harder for implantation to occur. Having a varicocele can also cause inflammation in the scrotum, which can affect sperm quality and quantity. And for both men and women, there are other conditions like autoimmune diseases where your body kind of starts to attack things, gets a little too excited and starts to attack its own cells, or exposures to environmental toxins and obesity that can impact it. Many people think obesity is just about weight, but it actually can also start to perpetuate a chronic state of inflammation that can affect hormones and fertility in both men and women. Often, when we think about hormones and fertility, conditions like PCOS in women and testosterone imbalances in men are the first thing that comes to mind. And these are definitely big factors. But there are also less obvious hormonal imbalances that can also impact your fertility. One that is often overlooked in the context of infertility are thyroid disorders, which can affect both men and women. The thyroid plays a huge role in reproductive health and influences everything from menstrual cycles to sperm quality. So I like to think of thyroid hormones as kind of the conductor of our body's hormonal orchestra. And if it's out of tune, the whole reproductive system can be affected. Insulin resistance, which is closely associated with PCOS, can also independently affect fertility by altering hormone levels and disrupting ovulation. Additionally, conditions like adrenal fatigue, environmental factors, exposure can cause exposures to endocrine disrupting chemicals that we can commonly see in household products or plastics, can also really wreak havoc on our hormonal balances, and they're less obvious causes. So it's really important that we understand that hormonal disturbances extend beyond just kind of the traditional tests and traditional diagnoses that we think of for them. And we need to kind of consider a more holistic or whole person approach when kind of doing some of this detective work. It shouldn't just be about treating the symptoms that the hormonal imbalance is causing, but we really should identify and address the underlying cause of the hormonal imbalance, which oftentimes is less obvious, but equally as impactful in helping you grow your family and meet your family planning goals. And it's no secret that what we eat impacts every aspect of our health, and fertility is no exception. Nutritional deficiencies play a significant role in both male and female infertility and are often overlooked and underestimated. So let's start with vitamin D. There's been a ton of research that has come out with this about over the past 10 years. Sometimes you can hear this called like the sunshine vitamin, and its role in bone health and cardiovascular health are really well understood. But what we're starting to see in the research for fertility is that it is really important for the development of the endometrial lining. It can help with implantation. And then during embryo development and pregnancy, it's huge for ensuring that all of that development goes according to plan. And in men, vitamin D deficiencies are linked to lower sperm quality and motility. And so it's really important that we're getting this evaluated on your fertility journey. Iron is another key player. For women, if you have inadequate iron levels, you are going to potentially have consequences to ovulation. So this means that you could be either ovulating really infrequently or maybe not ovulating at all. And in men, it can really impact sperm production. But the list doesn't just stop with those two. Other nutrients like folic acid, vitamin B12, zinc, omega-3 fatty acids, these are all really important for our fertility. However, even if you eat a balanced diet, you may have nutritional deficiencies, and often this is due to poor gut health. I like to think of the gut as the body's second brain, and its health is linked to so many aspects of our overall well-being, and we're starting to learn a lot more about this in the research. When your gut health is off, it can start to stir up some inflammation and just really throw things out of balance, especially your hormones. And I bet, going to be a lot more research that comes out about this in the next few years. So I like to think of our gut as just kind of this bustling city where there's trillions of microbiomes, and each of them has a really important role in maintaining our gut health. And this isn't just, a passive ecosystem. It's actively involved in hormone regulation. It's our first line of defense in our immune system, and it's imperative for nutrient absorption, all of which are critical for fertility. So for women, a healthy gut microbiome ensures that there's a proper balance of estrogen and progesterone and other reproductive hormones. It's essential for regular menstrual cycles and successful ovulation. For men, it supports the maintenance of testosterone levels and other hormonal balances that are crucial for optimal sperm production. However, when this kind of city starts to face some disturbances, known as dysbiosis, this can cause a ripple effect throughout the body. Sometimes these ripples can be really big, almost like waves, and sometimes they can be really subtle, often leading to inflammation and a ton of other health issues that may impact your fertility. So, this imbalance in the gut microbiome can stir up inflammation and just create like an internal environment that's just not ideal for conception. And then on top of that, poor gut health, as we mentioned, is essential for nutrient absorption. And so we're seeing nutrient deficiencies, and patients are having a really, they say a healthy, balanced diet, and you kind of look at their food log. I would really be checking out gut health because, if your gut isn't healthy, you're going to potentially have difficulty absorbing those key nutrients. And lastly, stress. It's no secret that stress affects our health in a bunch of ways, but when it comes to fertility, it can be pretty significant, sometimes underestimated. And the key player here is cortisol. Cortisol is our hormone that is released in response to stress, and it can have a cascading effect on all of our other hormones. The kind of challenge is that, we know it's impossible to live a life that is stress free. But what is important is that that during times of stress, we're being sure that we're one, turning to healthy coping mechanisms, and then learning how to manage our response to stress in a way that supports our overall well being and fertility. So, some effective strategies include prioritizing sleep, daily movement. Really, don't forget about to prioritize your relationship with your partner and your community, because those are going to all be great outlets for you to help manage your stress. So, when we talk about changes people can make in their fertility journey, it's really about shifting from a passive role into an active one. It's about moving from feeling like things are happening to you to feeling like things that you're making things happen for you. And there are a couple of key areas where we can make this shift. A significant part of addressing infertility involves shifting our mindset. And I think there's a twofold approach here. One, we have to, think that it's not just a temporary change that we're doing to try to conceive. We need to say, that these are things that we're, changing so that instead of, these are things that I'm going to do to make sure I get pregnant. We need to switch that mindset to say, these are changes that I'm going to make now so I can live a healthier future for me and our growing family. And this is huge. And there's been so much research that has been shown that when we're thinking about fertility as, improving our overall health, it really allows for sustainable changes for the future. And two, it's about moving from a place of why is this happening to me instead to what can I do about it? It's a really subtle shift in language, but it's a powerful one. And it's about taking ownership of your journey and becoming an active participant rather than a bystander. Now, changing the mindset isn't something that happens overnight, and it's a process, and it starts with education and understanding. The more you know about your body and your fertility, the more empowered you'll feel, and you'll be able to make more informed decisions. And this is where I come in, offering guidance and support, helping to demystify the process and make it just feel a little bit less overwhelming. So, if there's one thing that I recommend people to focus on to improve their fertility, it is mitochondrial health. And again, this needs to be done in a unified approach. This is because the process of creating healthy sperm and eggs requires a ton of energy, and mitochondria are our powerhouse. They are essential for ensuring that egg and sperm production and providing that energy to allow for successful fertilization and embryo development. If mitochondria are not functioning well, it can lead to poor egg health and sperm quality, and it can reduce that chance of successful fertilization and implantation. So, what can we do? You need to prioritize fueling your mitochondria, and I like to think of this as a four-step approach. One, we need to focus on nutrition. And for me, that means eating the rainbow. You really want to challenge yourself to eat as many colorful fruit and vegetables as possible. That's where all of those antioxidants are to help support those mitochondria. And we need to be intentionally fueling our body, not just eating out of convenience. Eating a robust amount of foods that are high in probiotics as well as omega-3 fatty acids are going to be amazing for mitochondrial health as well. Next, we want to focus on our elimination pathways. So that means that we're having, regular bowel movements, but if we're eating the rainbow, we're having higher amounts of fiber. So that should be dialed in. Movement, getting out 30 minutes of intentional movement every day is imperative. Hydration, you really want to be focusing on at least 2 liters of fluids every day. And that daily movement is going to allow for that sweat to happen, which is another elimination pathway. Number 3, we want to really be sure we're minimizing toxins. So we want to be mindful about what goes into our body and limit the use of plastics and try to minimize, the chemicals that are in or synthetic chemicals that are in personal products. So definitely, take a look at your products. You want to choose things that are kind of plant-based and also avoid any tobacco products, marijuana products, recreational drugs, and limit alcohol consumption. And lastly, we want to prioritize sleep. We want to aim for about 7 to 9 hours of sleep a night because sleep is crucial for mitochondrial repair and function. Navigating what changes to make for your unique situation can be incredibly overwhelming. So many couples have felt like there is something missing on their trying to conceive journey and have questions that they've tried to ask in the fertility care setting, but they've just kind of felt a little bit more dismissed. And so there's, traditional fertility care. We have functional fertility care, which definitely focuses on getting to the root cause of what's going on with your fertility. And then I like to say that my approach combines the best of both traditional and functional medicine. It's about more than just treating symptoms or relying solely on medical interventions. I aim to get to the root cause of infertility, considering all aspects of your health and wellness as a couple. So many fertility programs focus on just the female partner, but as you learned today, males contribute equally to infertility, and I believe to give you that best chance of success, you need to have a team approach. So my approach offers strategies to support both partners, ensuring that you both feel supported, confident, and empowered in your journey. I'm here to help you strengthen your bond and optimize your fertility together. It's all about providing you with the tools and support you need tailored to your unique journey. So essentially, I help couples turn fertility struggles into empowered success stories. If after listening to this webinar, you have concerns about your fertility or you feel you may be at risk for one of these common factors that we discussed, it's time to ask for help. Many people are unsure where to start, and the good news is that you are here today and you've already taken an amazing first step. The next step is to schedule an appointment with a provider you trust to get your answers. That could be working with a fertility consultant like me, your OBGYN, or a fertility specialist like an REI or an RU. Whatever path you choose, it's time to take action. As we wrap up today's webinar, I hope you're walking away with a newfound sense of clarity, confidence, knowledge, and empowerment in your journey. But most importantly, I wish that you leave today feeling with a renewed sense of hope. Thank you all for joining me today. I hope this webinar has provided clarity and has challenged you to switch your mindset and approach to your fertility journey. Be sure to check out your virtual swag bags. You will have access to my shared steps guide to optimize your fertility as a couple. You'll receive a link to a complimentary call with me to get to the root cause of your infertility. And for those of you who purchased a VIP ticket, you'll receive an exclusive discount. Remember, you're not alone on this journey. I would be honored to support you through your fertility journey, and I'm wishing you all the courage and strength and success on your path to parenthood.